It's all about giving. It's all about trust. It's all about people. It's all about us.
It's all about being human.
Vile nilikuja hapa, wakatibiwa vizuri, wakapatiwa hiyo chanjo. Narudisha tu shukrani. Tukiwa tena na siku ingine, muweze kutujulisha ili tuweze kuleta watoto.
Kwa sababu imekuwa ya kwamba watoto wamekuwa wakihangaishwa na ugonjwa wa measles, umeua watoto wengi. Hasa ikawa watoto waletwe hapa chanjo, wakatangaza kwa redio, tukaona hapana, wacha tupeleke watoto. Kweli wamekuwa na shida mbalimbali, homa, lakini tunajua kwamba kwa sababu hii chanjo watoto watakuwa wazuri, hakuna ugonjwa.
Na masaka tulipadi.
In Kenya, about 20% of deaths among children aged 5 years and below is caused by measles. The national goal to reduce morbidity by 90% and case mortality by 95% increased with a lot of effort being placed in immunizing all children with 1 dose of measles vaccine before their first birthday. Through the routine Kenya expanded program on immunization, children have been receiving doses of measles, and as a result, there has been a marked reduction of confirmed measles cases countrywide. However, with a population of 3.9 million children under 1 year, 1.75 million of these children have not been protected against measles and thus are vulnerable to the virus. Despite the immunization services being free, many children have not been vaccinated, which puts them at a high risk of dying from preventable diseases.
We get children from birth to 59 months vaccinated against measles, given vitamin A to strengthen and protect them from getting other diseases, and even nets to protect them from malaria.
In an effort to combat preventable deaths from measles, the Ministry of Health and other partners launched the first mass vaccination campaign in Kenya in June 2002. The successful campaign reached 13 million children between the ages of 9 months and 14 years.
These were what were referred to as hard-to-reach districts, which meant that our volunteers had quite a bit of work to do in terms of going to the households and encouraging mothers and caretakers to take their children for immunization. This gave us an opportunity to actually show the public and other partners that we can also add value to health interventions, especially the community-based ones. As a result of this, we were able to set up branches in areas where we did not have branches, for example in Tana River, where although the National Society had been involved in response, especially disaster response over the years, we did not have a real setup. So this gave us an opportunity then to be able to set up a branch, and now we have a branch in Hola and also a sub-branch in Garsen.
Since October 2005, over 1,600 children have been affected by measles. During this period, an upsurge of confirmed measles outbreak occurred in about 39 districts, and which put about 1.5 million children at risk of contracting the disease. At the height of this outbreak, 41 people, mostly children under 5 years old, died of the disease. About 30% of children in these areas have been immunized, which is below the recommended WHO standard of 95% coverage. The first phase of an emergency mass measles campaign from 29th April to 5th May 2006 recorded 100% coverage in the 7 districts countrywide that the Kenya Red Cross Society was coordinating social mobilization, especially in Northeastern Province. A total of 16 districts were covered countrywide, with more than 500,000 children between 9 months and 5 years targeted. Using the experiences of the first phase, the second phase campaign covered 62 districts countrywide.
During the second phase of this campaign, the society is going to avail quite a number of resources to be able to assist in this campaign, and in particular, the society has mobilized over 2,400 volunteers in these 17 districts, where in each of these districts we will have a team of Red Cross volunteers, community-based, who will be working very closely with the Ministry of Health and all other partners.
We had information that other chapters of the Red Cross had participated very successful in a few other countries that had conducted such campaigns. One of the excitement I got is when I saw a very huge consignment of very powerful trucks that were able to meet the challenge of any terrain. And they went to 20 districts in Western Kenya and 1 in Coast Province that we were distributing these nets.
The Kenya Red Cross Society, having successfully participated in previous national immunization campaigns, partnered with UNICEF, WHO, and the Ministry of Health for the second phase of the mass measles immunization campaign from 8th to the 12th of July 2006.
The main purpose of our social mobilization by the Kenya Red Cross volunteers was to increase and raise community awareness, and at the same time stimulate community dialogue. We also endeavored to promote essential attitude and behavior change in order to create demand for information and the services that were being offered by MOH, specifically for immunization and for the long-lasting insecticide-treated nets. We also tried to in this exercise to promote services for prevention, care and support. And in the process, we involved all the stakeholders in mobilizing communities for mobilization, and we also tried to mobilize resources.
This campaign had 4 components. Measles. This was a second dose for children between the age of 9 months and 5 years. Vitamin A. Vitamin A deficiency increases risk of disease and preventable blindness. The vitamin A dose was given to children of between 6 months and 5 years. Polio. Polio is a viral disease of the nervous system that causes sudden weakness to the legs and arms, resulting to paralysis. This vaccine was given to all children under 5 years. Long-lasting insecticidal nets. Malaria is a major killer disease, with the most vulnerable being children under 5 years of age, pregnant women, people living with HIV/AIDS, and the elderly. Long-lasting insecticide nets were distributed to each child that was vaccinated in the 21 of the highly malaria-prone zones of the country.
Itazuia umbu, itakuwa kiuma watoto kila mara, gonjeka kila mara. Sasa malaria iwezi kawashika kwa urahisi. tuko na furaha tu.
We expect that we are going to cover over 80,000 children in this district. So, and we expect that majority of them will come.
To provide for an effective campaign, the Kenya Red Cross Society had volunteers from the affected locations that participated.
We have supervisors and divisional coordinators in all the 7 divisions. And the exercise started on Saturday, where we have noticed that there are gaps. The Ministry of Health, together with the partners and collaborators, have commissioned outreaches, or what you can call mobile centers, to reach children who have not yet been immunized.
As a result of this, now we are looking at a follow-up of all these distributions that have been taking place and all the messaging that has been going to the community. So we are currently planning to have what we are calling the Keep Up campaigns, where our volunteers will be involved in certain districts, especially districts where the long-lasting insecticide-treated nets have been distributed, to ensure that they are being used and being used properly, and also giving the health messages at community level.
Indeed, when we launched this campaign in Kisumu in Western Kenya, every station that we visited, there were enough nets. The district medical officers of health on the ground told us that they had got a lot of support from the Kenya Red Cross in terms of logistics and personnel, the volunteers who were in various posts distributing these nets.
We made the difference in both campaigns to use our trucks and vehicles to distribute the bed nets, to take the vaccines and the cold chain, to transport staff and volunteers from both the government and the Red Cross. And this has been appreciated by all partners from the government, UN agencies, and other donor agencies. And we're happy that there is that recognition by the government and all other actors of the importance and the significant role that the Red Cross in Kenya can play when it comes to social mobilization.
It's all about being human and playing a part.
It's all about healing. It's all about life. It's all about helping the weak survive.
It's all about